Dear friends, welcome. The topic of today's issue is heartburn. Heartburn is a very common problem. I think that almost everyone has experienced it in their lifetime. Every single person has had to deal with it in their lifetime. And there's a large group of people who get heartburn, let's call it, on a regular basis. And different people heartburn manifests itself in different ways. Some people have it. Pain or discomfort in the stomach area, for some people. Some people have a burning sensation in the stomach, or a burning sensation behind the sternum. And the burning can be very intense. Some people even have a burning sensation of a lump in their throat. And heartburn is also often manifested by this kind of discharge of acid, a feeling of acid in the mouth. So there's an unpleasant or sour taste. Anyway, again, heartburn is a very unpleasant, sometimes painful condition. But quite often doctors just tell you to take a pill. And they don't actually do any treatment. As a result, people listen to these doctors and sometimes for years they take medications that don't cure heartburn, but just relieve the symptom. And in order to cure heartburn, you don't have to treat the symptoms with these drugs that reduce the acidity. You have to go after the causes of the heartburn. And that's what we're gonna talk about today. The first cause of heartburn that's very important to know about is the intake of certain medications that you've been taking for several months or even several years. There's a practice now of taking aspirin to thin the blood by taking aspirin. And yes, I think that blood thinners, especially in the elderly. But these same aspirin drugs irritate the walls of the stomach. It's quite common for some patients to experience heartburn as caused by these drugs. In that case, I think we need to thin the blood with other blood thinning methods. But still, I would say once again, if you're getting heartburn from blood thinning medications, you should try to get off the blood thinners altogether, or at least take them intermittently rather than continuously. Another group of drugs that often lead to heartburn are what are called nonsteroidal anti-inflammatory drugs. These are medications that people take to relieve back pain or joint pain. If these medications in short courses for a short period of time, heartburn won't occur. But unfortunately, there are times that people have to take these drugs for years. Or they don't have to, they just don't know that you can't use these drugs for a long time. And so in those cases, you can also get heartburn, and it's advisable to change the medication. Some high blood pressure medications can also cause heartburn. In addition, heartburn can be triggered by some of the medications that a person is taking to lower high cholesterol, some hormonal drugs. In fact, to list the drugs that can cause heartburn for quite a long time. And instead of listing these medications, let's do it another way. You need to read the labels of the medications that you take every day. And if you see the word heartburn, that means that medication. It's a good idea to replace it with something else. The second cause of heartburn, and I'm probably going to surprise you here, is the habit of eating a lot and a little bit. Doctors often say, you have to eat often and little by little. People follow that advice. And strangely enough, that advice can also lead to heartburn. Look what happens when you eat a lot and a little bit, and if they're constantly snacking, the person has eaten even a small amount of food, and that leads to the production of gastric juice, hydrochloric acid. A person has eaten once, they've had a certain amount of gastric juice, and then you eat a second meal, and you produce again gastric juice again. And so 3, 4, 5, 10 times. The result is that so much gastric juice is produced, so much that it just doesn't have time to be recycled back into the body. So there's a constant overproduction of gastric juice. And from there's a release of that gastric juice into the esophagus, you get heartburn. So if you want to get rid of heartburn, you don't have to snack all the time, you don't have to drink coffee all the time. From my point of view, you need to eat 3 to 4, 5 at the most times a day, and make sure that you have breaks between meals. Between meals when the hydrochloric acid, let's say, utilized by the body. The third cause of heartburn, no matter how many times you say, give dinner to the enemy, yet many people still eat a big meal at night. And that can lead to heartburn, especially when they've had a big meal and then they go to bed very soon afterwards. As a result, gastric juices flow into the esophagus, and you get heartburn. So I'll say it again, once again, don't eat too much at night. It's even better if you go for a walk after dinner. Take a walk after dinner, that would be great. The fourth cause of heartburn is a rush to eat. A lot of people eat on the run, and as a result, they miss the first phases of digestion, which is the chewing of food and the wetting of food with saliva. As a result, the food goes into the stomach poorly ground, poorly chewed, and unprocessed by salivary enzymes. It makes it harder for gastric juices to get inside the food clump, and digestion becomes more difficult. Therefore, the body has to compensate for the impairment of the first phase of digestion with more gastric juice produced, and a higher acidity of that gastric juice. So to get rid of the discomfort, to get rid of heartburn for people who are used to eating on the run, you need to learn to eat slowly. The fifth cause of heartburn is partially derived from the previous cause. A lot of people, especially who work in offices, tend to eat a lot of dry food, some kind of snack, cookies, candy, dry sandwiches, all of which are washed down with instant coffee. And that's what leads to the development of heartburn. So if we want to get rid of heartburn, what foods do we need to eliminate? I'm going to read out. First of all, dry cookies, buns, chips, salted nuts, crackers. What else provokes heartburn? Well, of course, smoked meats and a lot of carbonated drinks. They're very bad for the stomach wall. And then, of course, as everyone knows, it's very fatty food. So you have to try to minimize it, and of course, alcohol. In terms of the development of heartburn, the most common provocateurs for this unpleasant sensation are primarily cognacs, whiskey, red dry wine, some beers. But actually, here's the interesting thing. The same foods and the same beverages affect different people in different ways. What will give one person heartburn will have no effect whatsoever on another person. And as a rule, usually you know that it's that particular drink, or that particular food causes heartburn. And that's what they need to eliminate, or that drink should be eliminated from their diet. But there are other things that happen. Sometimes people can't identify which foods and beverages that cause the heartburn. I mean, they can't recognize that moment. For these patients, I usually recommend that for a week they start what's called heartburn diary, where you write down what you ate or drank at what time, what medications you took, how long before the heartburn started. And as a result, after you've had that diary for a week, you can, in principle, basically identify the triggering circumstance that caused the heartburn. Another factor in heartburn is nervous tension, stress, fears of some kind. That kind of nervous tension, some fears, some constantly irritating circumstances, all of these things can also lead to heartburn. And that's where the best thing to do is to be treated with sedatives. From the obvious, it's clear heartburn is common in people who have chronic gastritis. But what few people know is that heartburn can also be caused by chronic cholecystitis and chronic pancreatitis. That's something not everyone knows that, and explaining the mechanism why these conditions cause heartburn would take a long time. All we need to know is, if you have pancreatitis or cholecystitis and you want to get rid of heartburn, you have to treat the underlying condition, pancreatitis or cholecystitis. The next cause of heartburn that people who are into healthy living lifestyle. Well, what those people need to know is that heartburn is often caused by certain physical activities. Exercise, especially working out at the gym with heavy weights. And some yoga asanas, especially what's called the so-called inverted asanas, they can also cause gastric juices into the esophagus, and that causes heartburn. So if any of these exercises or any of these yoga asanas are giving you heartburn, just give them up. Another cause of heartburn is pregnancy. Here's pregnant women, especially when they're very far along with pregnancy, they often suffer from heartburn. So in this situation, you have to treat it symptomatically, as they say, which is to treat the symptom itself. Of course, it's better to choose heartburn medication together with the physician who is managing your pregnancy, dear women. And perhaps the last cause of heartburn to talk about today is smoking. Obviously, if you're a light smoker, 1 or 2 cigarettes a day, you probably won't get heartburn. But if you smoke a pack or even 2 packs a day, then that kind of heavy smoking can give you heartburn. And I realize that urging a smoker to stop smoking altogether is, shall we say, a questionable endeavor. But I would at least advise you to cut down on the number of cigarettes you smoke if you suffer from heartburn. Lastly, I'd like to offer you a few, let's say, folk recipes for treating heartburn, if you don't want to take pills. The first method is to take sea buckthorn oil. At the very beginning of the meal, take about a third of a teaspoon of sea buckthorn oil, and at the beginning, before the meal, just swish it around in your mouth. The second recipe is to drink sage tea after meals.